Okay, one thing that the boards loves to test you on is blood pressures. So let's talk about the blood pressure ladder and what they will actually test you on. Here's the breakdown, straight from the AHA-ACC rules. Normal, 120, less than 120 over 80, no meds. Elevated, 120 over 129 with a diastolic of less than 80. You treat with lifestyle only and recheck in 3 to 6 months. Stage 1 hypertension is 130 to 139 with a diastolic of 80 to 89. You only treat with meds if they have diabetes, CKD, or an ASCVD risk of equal or above 10%. Otherwise, lifestyle first, then reassess. Stage 2 hypertension is equal or above to 140 over 90, always meds, usually 2. So bottom line, you're really only using lifestyle for treatment of an elevated blood pressure, stage 1 hypertension, and less comorbidities, and you start with meds right away if it's 140 over 90 and above. But here's the catch. That's not what the boards is actually going to ask you. They're going to ask you something like this. You started a patient on lisinopril 10 milligrams last month. Today, you check their blood pressure and it reads 138 over 90. What's next? Are you going to increase lisinopril to 20 milligrams? Are you going to keep it the same and monitor? Are you going to keep the lisinopril at 10 milligrams and add hydrochlorothiazide at 12.5 milligrams? Or are you going to increase the lisinopril to 20 milligrams and add the hydrochlorothiazide at 12.5 milligrams? What's your answer? Make sure you grab your notebook for this next tip because this is exactly what the board is going to be testing you on. These two key concepts is what they're asking about. The first concept that the boards is testing you on is about hypertension medication. Now that you've started a medicine, what is the new blood pressure goal? Goal is now below 130 over 80. You must maximize one medication before adding another. So the answer for this question is going to be to increase the lisinopril to 20 milligrams because the blood pressure isn't at goal yet and you have not maxed out the medication. Save this so you can review it before your next exam.